Okay, let's take a look at the vertebral column. So first let's start off with some basic functions. Protects the spinal cord. So down the center of all these vertebrae, there's going to be a hole, and that hole helps form that vertebral canal. And inside that vertebral canal is the spinal cord. It also supports the head. All right, so this uppermost vertebra is known as the first cervical vertebra, or the atlas. And on top of that atlas is going to be your occipital bone. So the occipital bone uses the occipital condyles to articulate or attach to the atlas. So they named this first cervical vertebrae the atlas because of the Greek god Atlas holds up the earth, and this bone holds up the skull. It serves as a point of attachment, so we've got ribs attached to it. So the ribs are going to attach to the thoracic vertebrae. You're going to have a pelvic girdle, which attaches to the sacrum. And then you're going to have a lot of muscles. A lot of muscles attached to the vertebral column in order to maintain posture, in order to extend your vertebral column or flex your vertebral column. So a lot of muscles can attach and move that vertebral column. There is a distinct curvature. The curvature kind of gives the vertebral column strength and stability. So you'll notice up here in the cervical region, you have a curvature. Then the thoracic region curves kind of in the opposite direction. Then you have a lumbar curvature going again opposite of the thoracic curvature. And then the sacrum and coccyx curve back again. So it almost has this snake-like curvature. And that's viewing it from the side. So notice this is a lateral view. If we were to look at the vertebral column using a posterior view or an anterior view, there shouldn't be much curvature at all. So the curvature is important for strength, to maintain balance. It helps absorb shock while walking and running. So you want this curvature. There's 26 bones. So we start up in the neck, where there are 7 cervical vertebrae. Remember, the word cervical means neck, so those are the vertebrae in your neck. There's 12 in the thoracic region. Thoracic region is your chest region, so there's 12 there. There's 5 in the lower back. Typically, some people have an extra one, but there's typically 5 lumbar vertebrae in the lower back. There's 1 sacrum, but that sacrum is a fusion. So when you're born, you have actually many more bones than you do as an adult, because a lot of the bones are going to fuse together. So you're born with 5 sacral vertebrae, but over time they fuse into 1 sacrum. And the same is true with the coccyx. The coccyx is a fusion of many little vertebrae, usually 3, but sometimes it can be more or less than 3, but usually it's 3 coccygeal vertebrae that fuse to form your tailbone or coccyx. So it's important to know the numbers. All right, so C1 to C7 are the cervicals, T1 to T12 are thoracic, L1 to L5 are lumbars, and then you got 1 sacrum and 1 coccyx. Getting back to the curvature, so there are some abnormalities to the curvature. This is a lateral curvature. So again, we don't want the curvature going laterally off to the sides. A lateral curvature is called scoliosis. This is an exaggerated thoracic curvature. That's called kyphosis. And then an exaggerated lumbar curvature is called lordosis, which lordosis can often occur during pregnancy to help stabilize that kind of disruption in the weight due to the baby. So abnormal curvatures typically aren't a good thing. They can impede the spinal cord, they can pinch nerves, so there's a number of things that can be done for these abnormal curvatures. All right, so we're going to start with what we would call just your prototypical or typical vertebra. All right, and then we kind of look at differences, differences between what cervical vertebrae versus thoracic versus lumbar. But there are certain things that most vertebrae have. So we kind of go through that first and then point out, again, minor differences or what some vertebrae might have that others don't. So this is going to orient you. So this is the back. So this is posterior and this is anterior. So sticking off posteriorly, we often see a process sticking off there. Anteriorly is where you're going to find that weight-bearing portion called the body. You're going to have a hole in the center. So that's pretty typical of most vertebrae. The hole in the center is called the vertebral foramen. All right, so that means hole in the vertebra. And that changes a little bit, the shape. For example, when we look in the neck, it's almost more triangular in the cervicals. And then this is actually a thoracic where it's a little more round. The process sticking posteriorly is called the spinous process, and that might change. So we're going to look at cervical vertebrae, and your neck often kind of split at the end here. These thoracic ones often point downward, so we'll kind of look at some changes that occur with that spinous process. There's the body, and the body changes. So the body is the weight-bearing portion. So it should make sense that the further down the vertebral column you go, the larger the bodies are going to become, because they're going to have to hold more weight down at the bottom of the vertebral column than you would up at the top, say in the cervical region. These processes stick off kind of horizontally. Those are called transverse processes. All right, it just so happens these have these little facets. These are for ribs. So how I know this must be a thoracic vertebra are these little spots here and here. That's where ribs are going to attach. So notice it says facet for rib attachment. Those are only found on the thoracic vertebrae. So there's a little facet here, which is a little flat spot for attachment. And then there's one on the body here. They just don't show very well. These facets are how the vertebrae attach to one another. So this is a superior view, right? A superior view means we're looking from above, right? We're looking down at this vertebra. So these are known as superior articular facet. So what that means is whatever vertebra is above this one must be attaching to these facets. And then on the bottom of this vertebra, it would have facets that attach to the vertebrae beneath it. So articular facets are what the vertebrae use to attach to one another. This shows three of them kind of attached together. So this gives, and this is a lateral view, so we're kind of looking from the side. So we see 1, 2, 3 vertebrae. They all have their bodies, so these are the bodies. They all have a spinous process sticking posteriorly. So this would be posterior. This would be anterior. In between the bodies, we see the intervertebral discs, right? The intervertebral discs help to support those vertebrae. We see the transverse process. So this would be kind of projecting towards you right now, all right, whereas the spinous process is projecting posteriorly. There's that intervertebral disc. This hole here is called an intervertebral foramen. So intervertebral means it's a hole that's formed in between two vertebrae. All right, so there's a hole that goes right down here for the spinal cord. So the spinal cord would be running right down here. But in order for nerves to attach to the spinal cord, there needs to be a hole in between the vertebrae. So these intervertebral foramen are how spinal nerves gain access to the spinal cord. And then here would be an attachment, right? So this vertebra is using these inferior articular facets to attach to this vertebra beneath it. So this vertebra uses its superior articular facet. So facets allow vertebrae to attach to one another. This is what might happen when we see a herniated disc. So a disc has a couple different portions to it. It has this outer part called the annulus fibrosus, and then it has kind of a center core called the nucleus pulposus. And that's the stuff that often will get herniated, so it gets kind of forced out of the disc, and it can compress a spinal nerve. All right, so this is what gives this extreme lower back pain, or really any area along the vertebral column, but it's most common in the lower back. So this is a herniated intervertebral disc compressing a spinal nerve. All right, so now that's kind of given us an introduction. Now we're going to go through each region, starting with the cervical region, and just point out some of the things that cervical vertebrae might have that maybe the thoracic or lumbars do not. So first thing we need to remember are that there's 7. All right, so C1 all the way to C7. C1 is often called the atlas, and C2 is called the axis, but we'll talk about that a little bit later. First thing we notice is the vertebral foramen often is a little bit more triangular. The spinous process can be what's called bifid. Bifid means it kind of splits into 2. That's a feature only of cervical vertebrae. So you're not going to see that anywhere else. You're also not going to see these 2 holes anywhere else. These 2 holes are called transverse foramina or foramen. All right, so there's a couple extra holes in the cervical vertebrae. What those holes are for is you've got a couple blood vessels that go up your neck, and they're protected in these cervical vertebrae. All right, and they help supply blood to your brain. So if you see a vertebra and it's got 3 holes, you know at least it must be a cervical vertebra, because thoracics and lumbars do not have those holes. You can kind of see the cervical vertebrae here stacked together. If they all have this transverse foramen, you can see how a blood vessel would travel up those holes and be able to get up eventually into the brain. All right, so those are the main differences. They're also smaller, right? There's going to be less weight that they have to hold up, so their body is going to be smaller. All right, their overall size is going to be smaller. So make sure we understand transverse foramen only found in cervicals, and they're the only ones that might have the bifid spinous process. Here are some pictures of just C1 and C2. C1 and C2 are always going to be kind of the more important ones, because they allow your skull to rest on top. So here is the atlas. They also form what's called a pivot joint. So when you shake your head right to left, that's using a pivot joint between these 2 vertebrae. So here is your atlas, C1. Here is your axis, or C2. These are both kind of, this is a superior view here. This is kind of a superior lateral view, so we're kind of on an angle. Here's a lateral view of this C2. Here's a lateral view of C1. And then down here are the 2 attached to one another. All right. So a couple things to point out. First of all, again, atlas is C1. The atlas doesn't have any weight-bearing body. It really just has this little arch in the front and then an arch in the back. So it doesn't really have a spinous process, doesn't really have a body. It has a large vertebral foramen because your head's moving around and you don't want to compress the spinal cord. The axis has a very distinct structure called the dens. The dens points up from the axis and forms a pivot joint with the atlas. So this is a pivot joint, and what that does is it allows the atlas to rotate. So you notice the atlas is kind of just like a ring, and it'll rotate on that dens. All right, so we want to make sure we know that C2, or the axis, has a structure known as the dens, or odontoid process. That's the other name of it. So that's in your study guide. You'll see it. And that's only found on C2, or the axis. The next thing I want to talk about are the thoracic vertebrae. So the thoracic vertebrae are in your chest region. There's 12 of them, T1 to T12. What they're best known for is having ribs attached. All right, so we'll take a look at a picture that better explains it. But you're going to have a little spot here on the transverse process, and then there's usually a little attachment on the body. So when we look laterally from the side, we see that there's a little spot there for the rib to attach and a little spot there. All right, and those are facets for the rib attachment. All right, then the next thing I want to point out is the spinous process. The spinous process points downward in these vertebrae. That's kind of a feature of only the thoracic vertebrae. Let's move on to lumbars, L1 to L5. No ribs attaching, large bodies, so they've got large, thick bodies because of all the weight that is bearing down on them. Their spinous process is usually sticking pretty straight out the back, so it doesn't point down very much, and it's much thicker in height than the thoracic vertebrae. Here's a slide that kind of gives us, a lot of information comparing the three. I'll kind of point out what I think is most useful. Obviously, we see a size difference, especially with the bodies. Cervical is small, lumbar is very large. So the size, in particular the bodies, are much different. You'll notice the extra two holes. All right, so they have the two transverse foramen. All right, whereas thoracic only has one, lumbar only has one. You'll notice that the bifid spinous process is only seen in cervicals, whereas thoracic has a long, mostly projecting downward. Most project inferiorly. Whereas the lumbars are kind of blunt, shorter. They don't really stick downward. Other than that, there's a lot of other differences here. I don't think we need to go into much detail. But again, I like having all three in view, and then you can really see the size difference. You can see the extra two holes. You can see the bifid spinous process, and that kind of gives you the main differences of those vertebrae. One last thing. Sorry. This is very important too. Presence of rib attachment. So ribs only attach to those 12 thoracic vertebrae. You'll notice here I kind of highlight one other thing. These superior articular facets tend to face inward. So they face kind of medially when you look at a lumbar, whereas the thoracic and cervicals kind of face upward. All right, finally, the kind of the bottom of the vertebral column, we have the sacrum and then the coccyx, or tailbone. So we can clearly see that this sacrum must have been 4 or 5, normally 5, separate vertebrae that all fused together. And we can see where the intervertebral foramen were. There are actually nice distinct holes known as the sacral foramina. So those are just the holes in the sacrum. On top of the sacrum would be where L5 would be. So L5 attaches up here. All right, so we see that the sacrum has articular facets that attach to L5. This posterior view, there's what's called the median sacral crest. So median means down the middle here. So it's a little crest. That's where the spinous processes were, projecting off the back. All right, so we got the foramina, the crest, and then the coccyx, or tailbone, is also a fusion. You can see, and again, it's anywhere from 3, 4, or 5 typically. It looks like this one was a fusion of 4 little vertebrae. But recall that another name for your coccyx is your tailbone. All right, so that's the sacrum and coccyx. The next video, we're going to learn about the sternum and ribs, and together we call that the thoracic cage.